We will now discuss preoperative documentation for Dr. Misty Suri's shoulder surgery that you may have upcoming. That shoulder surgery will entail a pre-op appointment that you will have with us in clinic. At that appointment, you will be given a red packet of information with a bunch of papers in it. Those papers will discuss everything for surgery, and we'll go over everything you need to know for pre-op and post-op information. You're going to receive a packet of information like this that will have 2 copies, and 1 copy you'll need to bring with you on surgery day. That's what Dr. Suri will fill out and give back to you after surgery, and he will discuss that with your family member who's with you. The other copy is for you to keep, and you can do what you want with it. You can read over it and kind of go over everything you need to know for surgery. But when you come out of shoulder surgery, the main thing that you'll notice first is you're going to have 3 to 5 incisions around the shoulder that are going to be about the width of my finger. So not very big. They'll be stitched up with a dissolvable stitch, and we'll have steri strips over them reinforcing the skin. On top of that, you're going to have gauze wrap that's going to be covering your shoulder incisions, and we want you to leave that gauze wrap on your shoulder and in place for 2 to 3 days after surgery. Don't take it off during those first 2 or 3 days. Keep it clean and dry. We only want you to sponge bathe for those first 2 to 3 days. On the 2nd or 3rd day, you can remove the gauze wrap and you'll see your incisions. Please leave the steri strips in place. They're there to reinforce the skin. At that point, we want you to get some waterproof band-aids from the pharmacy and cover your incisions with the waterproof bandages. We have an example of waterproof bandages that we recommend in your packet of papers and how to use those. But cover the incisions with the waterproof bandage. Once you do that, then you're okay to shower. We want you to keep those incisions covered for 2 weeks after surgery to let the skin heal without any infection, water, or bacteria getting in there. So every day after you shower, you can change the bandages to make sure that no water leaked in there during surgery. And then you can leave it on the rest of the day until you shower again. Other thing is sometimes you will have an incision here in the crease of your armpit, and that's where Dr. Suri reattaches your bicep if that is included in your surgery plan. If you have that, that will be sealed up with some blue glue, so it'll look a little different than the other incisions. You can also cover that one with a waterproof bandage. Try the best you can. If you can't get them all covered with waterproof bandages, you can also use clear cooking saran wrap to wrap the shoulder to help keep it dry when you shower. At your 2-week post-op appointment, we'll then inspect those incisions and cut any sutures that need to be removed. Also, when you take the gauze wrap off your shoulder, you will notice that you'll have some TENS unit pads placed around your shoulder. Kind of like the 4 corners of a box, you'll have one here, 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 and here. They'll have the little wires sticking out, ready for you to use with your TENS unit. Once you get home after surgery, you can begin to use your TENS unit. That is a device that will be mailed to you by Zynex. Once you get that unit, you can plug it into the electrodes. What it does is it sends an electrical impulse to the muscles to kind of confuse the muscles and help to control pain after surgery. That device is not going to make you magically heal faster. It's not going to inhibit healing, but it helps control pain. You can use that device as often as you need to. You can use it all day. You can use it on and off. You could use it none if you don't like it, but it will help to control pain. In your packet of information, there is instructions on the TENS unit, You can also, it has an instruction book that comes with it. You can also visit their website, and they have a website address in your packet that will show you an instructional video on how to use it. You should always use it on the TENS setting. On top of that gauze wrap, before you take it off and when you wake up from surgery, you're going to have an ice pack that's going to be Velcroed to your shoulder and around your body. And that is going to have a little tube that runs down from it and plugs into a little box on the floor. You fill that box up with ice and water, you plug it into the wall, it circulates that cold water through your ice pack, so it's like an ice pack that never melts. It's a great unit that works better than anything you'll have after surgery. And it's going to help to control pain and swelling and inflammation. We want you to use that device as much as possible, especially over the days immediately following surgery. You can use that device 20 to 30 minutes on, 20 to 30 minutes off to help pain and swelling after surgery. In addition to that, we're going to call in some pain medicine for you. You may have a variety of different pain medicines depending on your other medical conditions, your age, and the type of surgery you're having. You will either have Percocet or Norco. Those are two different types of pain medicines that will help to control pain. And then you'll have Tramadol, which is a milder pain medicine. There's a couple ways that you can take those. There is, I would take the Percocet or the hydrocodone first for any pain you're having. If you take those and you're still having pain after you take those, you can take the Tramadol with the Percocet or hydrocodone for extra pain control. Some other ways people use it is if they take the Percocet or hydrocodone, which is Norco, first, and those work well and that's all you need, that's fine. If those wear off before you can take another one of those, you can take the Tramadol in between the Percocet or Norco doses to help the pain medicine last to your next dose of Percocet or Norco. So you can take those pain medicines together, separate, alternate them, however you want to do it after surgery. We want you to only take those pain medicines as you need it for pain, and we want you to wean off of those as you can after surgery. There's also a sheet included in your packet that goes over different pain medicine examples and how to take it, pretty much what we just talked about, and it gives you some specific breakdown examples of how to use that medicine after surgery. You'll also have Phenergan, which is a nausea medicine, which can help if you have any nausea from anesthesia or pain medicine after surgery. You may not need this after surgery, but you'll have it in case you do for any nausea. These medicines will be called in to your pharmacy that we'll discuss at your pre-op appointment, and you'll be able to pick those up prior to surgery. We recommend doing that so that you have all those medicines. Pain medicine can make you constipated, make it hard to go to the bathroom. So we recommend getting Colace, stool softener, to use after surgery to help with constipation. We recommend Colace. It's cheap, effective, works well, but you can get any stool softener after. The other thing is you may be instructed, depending on your age, other medical conditions, and type of surgery, you may be instructed to start 81 milligram baby aspirin the day after surgery to help prevent blood clots. We will let you know at your pre-op appointment if you have to take that. If you do, we want you to start that baby aspirin the next day after surgery, and we want you to take 1 tablet a day with food for 4 weeks to help prevent blood clots after surgery. You may also be instructed to take Prilosec with the aspirin to protect your stomach if you fall into certain categories. We will let you know if that applies to you. But the aspirin should always be taken with food to help buffer it on your stomach. In addition to that, you will also have some compression stockings on your lower legs that we want you to wear after surgery to help circulation and help to prevent blood clots from forming. Physical therapy will be required after your surgery. Depending on the type of shoulder surgery that you have, you will start physical therapy at different times. Some surgeries will start as soon as a week after surgery. Some surgeries may not need to start physical therapy until about 4 to 6 weeks after surgery. We will let you know what we anticipate at your pre-op appointment, and Dr. Suri will let you know after surgery when he discusses your instructions and has the sheet that we're discussing filled out. After your shoulder surgery, you'll also have a sling. So you're going to have a black sling like this that's going to be around your shoulder, and your arm is going to be in it. If you get a sling, we want you to wear that at all times except for showering. That sling may or may not come with a pillow, depending on what type of surgery you have. You may have a square pillow like this that will be attached to your side. You may have a bigger pillow like this that'll again be attached to your side. Whatever pillow you get, that's what we want you to use. If you don't get a pillow, then you don't need one after surgery. Whatever you get, we would like you to wear that until we instruct you to stop wearing it after surgery. Some things to remember with the sling and the pillow is if you get a pillow, when you go to shower, that pillow is there for a reason. Sometimes it is to hold your shoulder in a resting position, kind of away from your body. What I recommend is when you go to shower, get an old towel, roll it up in a cylinder, and then you can put that between your arm and your body to help your arm stay away from your body when you shower. You only need to do that if you have a pillow. If you do not have a pillow with your sling, then you just take your sling off and shower. We want you to try and keep your shoulders still when you take the sling off, unless you're instructed otherwise, because that will let what we did in your shoulder heal. After you get out the shower, please put your sling back on. Some other things to remember about a sling is we want you to take it off periodically, and we want you to keep your shoulder still, but move your elbow. That will keep your elbow from getting stiff. We want you to move your wrist, twist and turn your wrist. You may have a stress ball that you can squeeze to help those joints from getting stiff. The other thing is with a lot of those surgeries, you can work at a desk. You can bring your hands up to your mouth if you need to. The main thing is keeping your shoulders still. You will wake up with that after surgery. Driving instructions may be given to you after surgery, and usually while you're wearing the sling, we do not recommend that you drive because one, it can mess up your surgery, and two, you may not be safe operating a vehicle and may not be safe if you need to suddenly swerve the wheel to protect yourself or somebody else. If you have any emergencies, you can always call our office or go to the emergency department. We have some information on emergencies in the packet. The other thing is, for shoulder surgeries, you may not start physical therapy right away, but you will have some exercises checked off in your packet that Dr. Suri wants you to start the next day or two after surgery to get little muscles firing after. Those exercises may be doing some shoulder shrugs, bringing your shoulder blades kind of back together. He will have those checked off afterwards, and we want you to do those as instructed. We also would like you to get Clearasil cream or gel prior to surgery. We have a sheet that will be in your packet that will discuss exactly what we want you to do with that. It has some pictures on there that I took at Walgreens. You can get this at any drugstore. Basically what it is Clearasil cream or gel. If you buy the generic brand, we want it to be 10% benzoyl peroxide. We want you to get that cream or gel from the pharmacy, and starting 2 mornings before surgery, we want you to apply that to the shoulder, in the front of the shoulder, the back, and in the armpit. There is a color-coded display of how to apply it. We want you to do that starting 2 mornings before, in the morning and at night. We want you to leave the cream on all day and all night. So apply it in the morning, leave it on all day. At night, if you shower, you can shower and then apply the cream again. Leave it on all night. In the morning, we want you to reapply it. So we want you to do that starting 2 days before surgery, morning and night, morning and night. And then on the morning of surgery, you're going to wake up, you're going to shower with the Hibiclens or Dial antibacterial soap that we will discuss in another video. And after you shower with that, your last application of Clearasil is going to be the morning of surgery. And you're going to apply that to your shoulder in the same form or fashion. And then we want you to actually come to the hospital with the cream on your shoulder. That cream helps to prevent a resistant bacteria from living on your shoulder that can cause problems after surgery. If for some reason your pre-op is not 2 days prior to surgery, we recommend getting the Clearasil and using as many applications as you can do before surgery. Optimally, we would like you to do 5 applications, with the last one being in the morning of surgery. Next, we're going to talk about eating prior to surgery. We're going to call you with an arrival time for your surgery. Whatever time we give you, there's no eating 8 hours prior to that arrival time. This includes gum, hard candy, mints, chewing tobacco, or anything you put in your mouth. Once you're inside of that 8-hour window, you can continue to drink water or clear Gatorade up until 2 hours prior to your arrival time for surgery. We do want you to drink some water or clear Gatorade prior to surgery, because that helps to keep you hydrated, which helps things to go well for surgery. But once you're inside of 2 hours prior to your arrival time, we don't want you to eat or drink anything until after surgery. The next sheet you'll find in your packet of papers will be a sheet that instructs you to call us between 12 p.m. and 4 p.m. the day before surgery to find out your arrival time for surgery. You only have to do that if you do not hear from us by 4 p.m. Otherwise, we will call you the day before surgery between 12 and 4 p.m. to let you know your exact arrival time for surgery. That's because Dr. Suri has some surgeries come and go off of his schedule, so we will finalize the surgery schedule the day before surgery and call you to confirm your arrival time. Your time will likely be early in the morning, sometime between 5:30 and 11:30 a.m. The time that we tell you is very important, and it's important to arrive promptly at that time. We have to prep you and clean you for surgery, and if you arrive late, this could cause a delay in our surgery schedule and could cause your surgery to be delayed, and it could get pushed to the end of our surgery schedule that day. The other thing is, we want you to get either Hibiclens cleaning soap, which is a strong antibacterial soap, or Dial antibacterial soap, which you can find at any pharmacy. Both of those soaps can be bought without a prescription. We recommend the Hibiclens, and we want you to shower from the neck down the night before surgery and the morning of surgery to get you as clean as possible. It is important to scrub the surgical area thoroughly, but not too hard to cause abrasions. If you're having shoulder surgery, we expect you to clean under the armpit well. On the day of surgery, after you shower in the morning with the soap, we don't want you to put anything on your body. No deodorant, no body lotion, no cologne, no perfume. We want your skin as clean as possible for surgery. It's important that you remove all jewelry, metal, piercings from your body prior to surgery. If you have a piercing or ring that you cannot remove from your body, it's important that you address that with us or anesthesia prior to surgery. Also, Please be careful not to get any cuts or abrasions around your surgery site prior to surgery. I would not shave your surgical extremity. We will do that on the morning of surgery. If you get any new cuts or abrasions around your surgery site, we may have to cancel surgery for risk of infection. In your packet of papers, you will have some information on your TENS unit that will be supplied to you by Zynex Medical. They will call you to let you know that we have sent them a prescription for a TENS unit, and they will want to ship it out to your house. In your packet, you will also find a sheet on how to take pain medicine. It's got some things with examples of how to do it and explains to you how to rotate or alternate your pain medicine. At the bottom, we have an option for severe pain that you can follow if you're taking all the pain medicine as it's prescribed and you're still having severe pain. These options let you do little small increased amounts or frequency of those doses for little short periods of time, so you can always read over that. Some tips are that pain medicine contains Tylenol, and it's also important that you do not exceed 3,000 milligrams of Tylenol in a 24-hour period. That's also at the bottom of this sheet. The next thing you'll notice in your packet is a sheet that goes over warning signs for blood clots after surgery, which are also called DVTs. This sheet goes over signs and symptoms of a blood clot. Surgery puts you at risk for blood clots, and those can occur in any extremity after surgery, your arms or your legs. It's important that you know the signs and symptoms, and if you think you're getting a blood clot after surgery, please call us so we can address those concerns. And if we suspect a blood clot, we will more than likely have to get an ultrasound to rule that out to make sure that you don't have a blood clot. If you can't get in touch with us and you think you're getting one of these, we suggest go to the emergency department for surgery. It's also your responsibility that if you are over the age of 40, you get surgery clearance from your primary care doctor. We should have instructed you prior to surgery if you needed this or not. If you are instructed to get it, it's your responsibility to get this prior to surgery. And if for some reason you do not have this prior to surgery and we do not have documentation in our office, your surgery procedure will be canceled and delayed until we get it. It's also important to remember to read over the information and the pieces of paper that we have given you prior to surgery. The videos are a good tool to help you get prepared for surgery, but the packet may contain a few small things or some more details that were not discussed in these videos. Between the videos and the information in the packets that we have given you, you will be prepared for surgery and know everything you need to know to have a great outcome after surgery.